Hi, I'm Terry Kungle, and I'm the president of the Maine Coalition to Fight Prostate Cancer. I presume if you've tuned into this video that you've been recently diagnosed with prostate cancer, or someone that's a loved one has been diagnosed with prostate cancer. That's bad news, but we need to keep it in perspective. My wife's sister Caroline was diagnosed and died from amyotrophic lateral sclerosis, ALS, or Lou Gehrig's disease. That's a disease that claims 100% of the people that are diagnosed. Prostate cancer is a tough disease, but it only claims approximately 15% of the patients that are diagnosed. So let's assume that you're in the 85% that's going to make it, because most of the guys do. None of us are doctors. We're only patients like yourself who've gone through this process. But I think one of the things that we're going to try to do here is not only tell you about the different options, but also give you a framework for deciding how you go about making a decision. Ideally, I'd like to be able to sit down with each one of you and go through the specifics of your case. Obviously, we can't do that, but there's a couple of things that I'd like to refer you to so that you can do some work on your own to get to a choice sooner. The National Comprehensive Cancer Network has put together a nomogram that looks at each patient, and there's a number of variables that they go through: age, severity. There's a bunch of different parameters that you can work through this essentially decision tree to figure out what might make the most sense to you. These are the same documents that the physicians are using to help guide what they do with prostate cancer patients. So this is something that I would actually have you look at. We have it posted on our website. We'll give you some of that information later. The second thing that I will suggest that you look at, and this is also on our website, is there's a New England Journal of Medicine article, Quality of Life and Satisfaction with Outcome Among Prostate Cancer Survivors, that gets into and looks in a rigorous fashion what the different experiences men have had with the different treatment options. We can't, in this short video, cover all the different outcomes and all the side effects, but if you go to the National Comprehensive Cancer Network decision tree, and if you read this New England Journal of Medicine article, I think both of these will help get you a lot farther along, faster than a lot of the hunt and peck that many of us went through. Now, when we talk about treatment options, there's actually one treatment option that we would encourage men to consider that have low risk prostate cancer. And specifically, I'm talking about active surveillance. Now, active surveillance is only for the guys that have low risk prostate cancer. Now, how do we define that? There's different answers to that, but generally there's some consensus building that active surveillance is ideal for men who have been diagnosed with a Gleason score of 6 or less. They have 10 nanograms or less PSA rating, and they have a PSA velocity, meaning the rate of change in the PSA below 1 point in the last 12 months. Now, just to be specific about what we're talking about with active surveillance, it doesn't mean doing nothing. There's actually fairly well-established regimens. They vary from one hospital and doctor to another, but they generally entail getting a prostate-specific antigen test every 3 months until it looks like their PSA is fairly stable. Then you can slip the PSA testing to every 6 months, but that's something that varies on your individual case and your doctor. On an annual basis, you'll probably be doing a transrectal ultrasound to again identify if there's something going on that's being missed with the PSA measures. It turns out some of the more aggressive prostate cancer can actually report lower PSA levels. So PSA doesn't tell you everything. It's an indicator. It's not the sole indicator. You also want to be doing digital rectal exams to see if there's any nodules. So active surveillance is something that is a new regimen, and it's something that men who sign up for it have to basically make a commitment that as long as the data continues to suggest not doing anything, that men don't leave the program because of anxiety or frustration and go off and do a procedure that may be unnecessary. There are some very significant benefits of pursuing active surveillance. The chief one is that by staying on active surveillance, you're not doing a treatment, you're not doing a primary treatment, and then you forestall any of the side effects that come with all of the different treatment options. You won't have to deal with any issues of incontinence and impotence before your primary treatment. So there's some huge advantages of following and pursuing active surveillance. The other advantage of doing active surveillance is it starts to address the issue of reducing the amount of overtreatment that has occurred in prostate cancer. Now, the older patients will recognize active surveillance as watchful waiting. Now, the discussion about the side effects is something that we really need to talk about, because one of the important issues for anyone looking at these primary treatments is, what can I reasonably expect? And here we've got to really level with you and say that there are issues of urinary incontinence with all the different treatment options. There are issues of erectile function and impotence with all of the treatment options. And with radiation, there's also the issue of fecal incontinence. And the range of frequency of these vary depending upon the physician you're working with, your condition. So there's a range of frequency, how often does it happen? There's also a range of severity, and you really need to talk to your physician about your case to get a better handle on that. I will say that if you do have these side effects, and every one of these treatments will at least impact you initially, so you will absolutely go through some of these side effects. If you do have these side effects, there are treatments. It's beyond what we're trying to do in this video today, but we do want you to know that choosing a primary treatment in prostate cancer will entail side effects. They're manageable, but they do exist, and you need to know about them. But you need to take into account that as bad as some of these side effects may sound, you want to do what you need to do to not let prostate cancer kill you. My grandfather, my paternal grandfather, died of metastatic prostate cancer. My father died of metastatic prostate cancer. And part of what this video is trying to do is to get you guys to make the hard choices so you aren't going to be claimed by prostate cancer.